You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says that nobody should be wearing a loose-fitting denture. And if you've been told you're headed to dentures, you have to hear what he has to say. He's been on our program before, Dr. Jeff Mader. Dr. Mader, welcome
Hey, Randy.
to the program.
Great to be back. Thanks.
Now, you are what they're calling like the go-to guy in Indiana for implant dentistry.
Yeah. Well, we just love helping people out, and I can't believe the number of people that are out there who need our services. There's so many people that have had problems with their teeth their whole life, whether it's loose teeth or cavities, broken teeth, abscesses. They're just constantly going to the dentist. Every time they go to their dentist, they've got to come back for something. It's just an ongoing monkey on their back.
Okay.
And now we've got a way to really put an end to that, give someone a brand new set of teeth, a brand new smile, really start a new chapter for patients so that they've got a way to go to a restaurant and enjoy whatever they want, whatever's on the menu. Not worry about their denture coming out when they're talking to their friends or their spouse.
So no more dentures.
No
You
more
believe
dentures.
that? I mean, is that the future of dentistry? Like dentures as we know them today that aren't attached to anything will all be attached to something in the future, like implants?
Randy, my grandparents wore dentures, and I think their parents wore dentures. And there's just no reason with the technology that we have today why anyone should be a denture wearer. I mean, that's just old. It's old school.
That you do it very quickly, and we've talked on the phone, and because I was asking you what's changed, things like that. But you say what used to take you 6 months or 10 months, now you can do it in like 2 or 3 visits.
Yeah, so, when dental implants are not new. They've been around a long time, 40, 50 years.
Okay.
But when I first started out in my career and doing this type of restoration, it took a year, start to finish. And then recently, probably 3 to 5 years ago, that was down to 5 to 6 months. Lately, within the last year, there's a new process called XD, where we're able to get this done in 3 weeks. So
Okay.
if you're a denture wearer and you're tired of wearing your dentures, you come in to see me, and we put the implants in, and 3 weeks later, you get a finished set of fixed teeth.
So what about those people that have like gum disease, bleeding gums, a bad breath, the loose teeth, and you need to extract those teeth? Is that much longer as far as time frame getting it done?
It's the same amount of time. So whether you're currently wearing dentures or if you're just at the end game of your life, if your teeth are just not savable, if you're ready for a new chapter in your life, 3 weeks start to finish. We take the teeth out, put the implants in, and 3 weeks later, you've got the finished restoration. And in the meantime, too, you've got a great smile. So no one ever leaves my office without a great smile. Every day, I see patients who have spent an incredible amount of time and an incredible amount of money trying to save their teeth. Every time they go to the dentist, they've got to come back for something. And these are patients who are plagued with gum disease, tooth decay, chronic infections, broken teeth. They've been going to the dentist every 6 months the rest of their life, and yet still they get to the point where they just cannot save their teeth. Randy, think about the typical 80-year-old who's probably got a knee replacement or a hip replacement. I mean, our body
An 80-year-old
parts.
we're talking about.
Sure.
Okay.
Our body parts eventually wear out. The same is true for teeth. Our bodies were not designed to last as long as the doctors are keeping us alive.
Okay.
And there comes a point when, despite all the efforts of a great dentist, you just can't keep your teeth any longer. And it used to be that the end game was to get your teeth out and have a set of dentures. It was a foregone conclusion that if you lived long enough, you were going to be wearing dentures someday. And that is absolutely not true. There is no reason why a person cannot get a full set of a brand new teeth, basically a third set of teeth.
Okay.
So, you've got your first set of teeth when you're a little kid. As you grow into 10, 11, 12-year-old, you get the next set, and that set is supposed to last you the rest of your life. And in today's world, with all the foods and drinks that we enjoy, with gum disease on the rampage, with trauma, so people are, maybe you're playing catch when you were a kid and the baseball hit your front tooth, or you're jumping on the bed with your sister and you hit the bedpost, or something happens. Keeping your teeth the rest of your life. I mean, I rarely see someone in their 80s who's got a full set of teeth. It's just maybe once a year.
Yeah.
And so teeth are just high maintenance body parts. And to expect them to last the rest of your life is just not reasonable. but to also have to spend the rest of your life, the latter part of your life, right, which should be the best part of your life.
Okay.
You know, you work your whole life, all of a sudden you're ready to go out and travel with your spouse or spend more time with your friends and family. There's no reason why you should have to be lugging a set of dentures around.
Good point.
And have some dental implants. Have a full set of teeth that never come out, that don't limit what you want to eat.
What do they like the most? Do they like the way it looks? Because I've seen, and you brought a bunch of photos, so we're going to get to as many of those as we can. But do they like the looks, or do they like what they can eat?
Yeah,
What do they
both.
like
You
more?
know, well, they're checking both boxes. Okay, so I've got patients who come in who are really, they'll tell me, you know, I really don't care how I look. I just want to be able to enjoy a meal. Or they'll say, you know, I'm not too worried about what I can eat. I just really want to look good because my daughter's getting married in 4 months, and I want to be able to give the toast at the wedding. But yet, when they come back to see me for their follow-up checks, they all say the same thing. Well, first, they say two things. They say, how come this didn't hurt?
Okay.
So they can't believe how easy the process is. And the second thing they always ask me is, why didn't I do this sooner?
Okay.
Why did I spend the last 10, 20 years of my life trying to keep these teeth that are hopeless? Or why did I spend the last 10 years of my life wearing a denture that I hate? I've got patients who go in and have a set of dentures made because they're totally unaware of this technology, and they've never been able to wear an upper denture. They come in with this thing in their pocket. They don't have teeth. They absolutely cannot wear an upper or lower denture. And so this is a transforming life experience. So, Randy, you've got a great set of teeth, right? I mean, look at that smile of yours.
Well, thanks. I got lucky.
Yeah, you go to the dentist every 6 months, I'm sure. But there are patients out there that, despite their best efforts, despite how many times they've swiped the Visa card, they cannot keep their teeth. And they don't realize what happens to the human body over the course of 10, 15, 20 years of having this low-grade chronic infection.
So that's what it is.
So
it's an infection.
It's an infection.
Okay,
You know?
okay.
Tooth decay is an infection. Gum disease is an infection. And it has ramifications throughout our whole body. Gum disease is the #1 cause for heart problems next to smoking.
We have medical doctors on the show that now part of their protocol, when you read heart books, they all talk about if you have gum disease, if you have a bacterial infection in your mouth, there's an immune response, and it's causing a lot of problems in the rest of your body.
Yeah.
This has now become mainstream.
For sure.
So when you take out these infected teeth, do they feel better? I wanted to ask you that.
So they don't realize how bad they felt. So what they say when they come in is, you know, I've just got a little extra pep in my step. I've got a little extra energy, and I really didn't know the toll that this took on my overall general health. So patients are feeling better, and man, they are looking great. So you're asking me about whether or not the aesthetics is important or the function. I mean, they're both important to people. They just may not realize it. I want to tell you about a patient, Wes, who I spoke to on the phone last week, and we just finished giving him a brand new set of upper and lower teeth. He wore a beard for the last 20 years of his life.
Okay.
And he came in to see me, and he shaved his beard. I'm like, Wes, you know, you look like, I didn't even recognize him walking down the hallway. So here's someone who had to hide his teeth because he was really embarrassed about what they looked like. But his main motivation was he wanted to be able to go to a restaurant with his wife and order steak and not to take 30 minutes to get through it. So he went through the process of getting a new set of teeth really just for function. But what he told me is, you know, 20 compliments later, as he's walking around town, seeing his friends, seeing his family, he's like, I had no idea of the difference that this would make in my life. And he looks like a totally different person. I'll show you the before and after pictures a little later, but you won't even recognize him. And so it checks both boxes. People are getting a brand new set of teeth that they can eat whatever they want with. They can enjoy a meal like they haven't enjoyed in years. And they look fantastic. It's really a life changer.
When they're on the consult with you, and they're telling you sometimes their hard luck story, do you ever secretly kind of getting excited, going, they have no idea how good this is going to be?
Oh, all I can do is envision what their smile is going to look like while I'm sitting there talking to them. Sometimes I have a hard time getting people to smile because we spend a lot of time looking at their face and their smile as we're planning their smile out. You know, it's not just a haphazard thing. There's a lot of science and years of experience that go into creating a smile. And so just as I'm talking to someone, like if I met you for the first time, I'd be studying your smile, how your lips move, how much teeth you show when you smile, and all the changes that we want to make. Right. So we kind of build on what people like about their smile, and then we change everything that they don't like about their smile. And patients get a chance to approve this. So we kind of go through a trial run through some photography, so that they can see what their smile is going to look like before they get it and say, Jeff, yeah, man, we hit the home run here.
Right?
I love it.
Right?
We talk about the color of the teeth, the length of the teeth, how much of their teeth they should show when they smile. So these are all subtle little things that people don't even think about that go into building a great smile.
Everything we're talking about, you teach other dentists, right? Is that true?
I do,
you're an instructor with this company called Highbridge.
I do. I have the privilege of doing that. And so...
is there more art or science? I mean, because, like, for example, I'm not endorsing you from the show. I'm just asking the questions. But, I've seen photos on these shows, and these teeth look as real as... they're real looking.
Yeah.
So what is it? More art, more science? And can you teach that?
Yeah, there's both. I think it's experience. After, I close my eyes at night when I'm going to bed and I see teeth. I can't help it.
Really?
And it's just what I do. And I see great smiles. And so there's art and there's science. We build this technique on years and years of the forefathers of implant dentistry, but yet we use my own experience, and I've been a cosmetic dentist for 30 years, so I know what a smile should look like. And that we build into this. So when you get your brand new set of teeth, man, it's going to look fantastic. It's going to be, it's a home run. I'm shooting for that every time.
And even though you teach it, you say you travel all over the U.S. taking continuing education on implant dentistry. Is there that much to know about this? Aren't you running out of stuff to learn?
The field just keeps advancing, keeps getting better and better. As we talked about, what used to take a year, then took 5 or 6 months, now only takes 3 weeks. I mean,
which is only 2 or 3 visits, right?
3 weeks. 3 weeks apart over 2 to 3 visits. So you've got to stay up to date. I mean, continuing education is just part of my reality.
And you do some of the planning on a computer, right? I mean, it's kind of computerized.
Everything's digital. Everything's digital.
Okay.
Yeah. Which is really what got this down into a 3-week process, is because everything's digital. So.
Okay. Now you have patients, because you're on television there, right? And they come in and you say that they watch your interview, the interview we did together, like several times.
Yeah.
And then they force their poor family to watch it.
I have a patient who she was up at in the middle of the night. Her dog was having puppies, and she's never up at that time. But this show actually happened to be airing in the middle of the night, and she's like, I think it was fate that my dog was giving puppies at 2 o'clock in the morning, because I got to learn about this. And
somebody wearing a denture is going, I didn't even know this was available?
Exactly.
Really?
Most people don't know this is available. And most people don't think that they're a good candidate for it, because if they have researched it, they've learned that the myth is that you need a lot of bone to do this. So
but it is true, though. I mean, if you've been wearing a denture 10 years, you've
had bone loss for sure. For sure.
But you can't do this if you've been wearing a denture that long?
You only need 9 millimeters of bone to do this, which is
so you can do it?
Yeah, for sure. It's rare. I would say it's 1 out of 100 patients I see that are not a candidate for this. So almost everyone, if you've got bad teeth and you know that you're heading toward a denture, or if you've been wearing a denture for 20 years,
you could do it.
Odds are pretty darn good that you can do this.
Yeah, I mean, you're one of the busiest guys in Michiana, you told me. In fact, I said, well, do the dental implant reps, did they tell you you do the most? You said they do.
Yeah, well, that's what I hear. And it's kind of what I do. So
I mean, you do more in like a month than most guys do in a year. Is that fair to say?
I would say that's a fair statement. It's the niche in my practice. So in our practice, we've got some great dentists who do some awesome restorative dental work. But my niche is really the world of either cosmetic dentistry or implant dentistry.
Now, in California, where we are right now, that how it's typically done is you go to 2 places. You go to one place that does the surgery, another person that puts the teeth on top, and even somewhere else where they do the cleaning.
Yeah.
Is Indiana similar to that? As far as the typical way to do it?
That's the typical way to do it, and it adds to the cost. So if you're going through this process, and typically you've got to see an oral surgeon to have the teeth removed and have the implants placed, and then you go to the restorative dentist or prosthodontist to have the restoration placed. And it adds to the time, and it usually doubles the cost.
Okay.
So because we are able to do this under one roof, The efficiency is amazing. Again, getting this down to 3 weeks. But also, we pass that savings on to our patients. So we're able to do this for half.
Now, I have to ask you this, though, that even with the best dental insurance, it only covers a very small portion of the implant, and Medicare, Medicaid doesn't cover it at all. So what's the answer for those people?
Yes. That's a great question, Randy. I mean, most people don't budget for this. I think they'll be shocked to find that it costs a lot less than they think.
Okay.
And I think they'll also find that if you've got decent credit, that this is something that's easily financeable.
Are people financing it?
Most patients do.
So every day there's somebody financing
every day.
dental procedures.
We've got a great arrangement with 2 local banks. And this is something most patients finance and can get this down to a reasonable monthly payment.
You brought some photos. What are we looking at?
So, Randy, I can't wait to show you these.
Okay.
These aren't just before and after pictures. These are transformations.
Okay.
So take a look at Karen. You know, you'd look at her smile and go, boy, that's really a pleasing smile.
It's not bad, yeah. It looks good to me.
What you don't see is the underlying infection that's going on. So she was plagued with gum disease, broken teeth. She was missing some teeth in the back. And it just was to the point where it became much more economical for her to get a 3rd set of teeth. You know, Karen has worked hard her entire life to keep her teeth. I mean, she's brushing, she's flossing, she's going to the dentist regularly. But sometimes it's just a battle that people can't win. So there's just overriding infection that finally took over, despite her best efforts. So you couldn't save those teeth? Couldn't save those teeth. And I commend her on all the efforts that she made to do that. But we gave her a brand new smile. And when you look at it,
it looks good.
It's not just the teeth, you know. It's the new Karen. I mean, she is so excited. I don't think when I see her when she comes in for her regular checks, you know, I don't know if she knows whether to laugh or cry because she's just so excited about her new smile. And it's really this is a life-changing event for people.
You told me because we've talked. I always think that the dentists are exaggerating, right? But like you say, it makes somebody more attractive. Yeah. She's definitely more attractive. She looks younger. She looks like more vibrant.
Right.
Everybody would agree with that part.
She looks smart, confident. She's ready to take on the world, you know. I mean, when she walks into a room, she lights it up because she's got this fantastic smile. And then you take a look at the detail that went into her smile too. When she smiles, you see all of her teeth. If you look at the before photo, her teeth just kind of die off in the corners, in the sides of her mouth.
I see
now
that.
She's got a full complement of teeth, at the beautiful color, perfect length that accentuates her lips. These are the details.
And she can chew whatever she wants.
She can eat whatever she wants. So she goes into a restaurant, looks at a menu, and orders anything she wants. And those are things that now I don't think she had those sorts of issues because she still had most of her teeth.
Yeah.
But for patients who are missing most of their back teeth, which we see every day, and for patients who are plagued with gum disease, so they bite on something and it hurts. For people who are denture wearers and haven't enjoyed a salad in 15 years, I mean, it's a life-changing experience. By the way, all this is done, Randy, while people are sedated. Okay, so we send them off to La La Land. These are the same drugs that we use for if you have a colonoscopy, if you have cataract removal, if you have...
So it's IV sedation.
It's IV sedation. So if it's any type of, if you go into a hospital for an outpatient procedure, you're going to be sedated, right? Yeah. And yet we expect people to come to the dental office, recline them, put them in a vulnerable position, and expect us to have a smile on their face. You know, we as dentists are like, how come nobody likes to see us, you know?
That's a good point. This is good.
So we've taken that burden away from people. So people who have been afraid to go to the dentist. So, a lot of the people that I see haven't been to a dentist in 15 years because they had a horrible experience as a kid or as a young adult. You know, if you're in your 70s, well, when you were 12, anesthetic hadn't even been invented yet. So going to the dentist was a torturous experience. So there's a huge group of people, and I could fill up the Notre Dame Stadium with people who are afraid to go to the dentist. And
you're monitoring them. I mean, what they're like, their oxygen, their blood pressure.
So it's not general anesthesia. you're somewhat awake for the whole process.
So you numb them up, you give them the sedation.
Yep. Well, we sedate them first before we numb. Yeah.
Oh, I got it. Okay.
So you are totally sedated for the entire process. These drugs also have great amnesic properties, so people don't even remember. So when they're kind of back with it again, they're like, "Okay, doc, when are we going to start?" And they're like, "Well, we're done." You know.
So some people have like a vague memory of it. Well, that's good. That's good.
So all of this is done while you're sedated, and so
I've had doctors on the show though, and they said, you know, if you have a good bedside manner, you know, you don't need to do that kind of sedation.
Yeah.
Do you feel like that's almost insensitive of a dentist?
So I have patients
you have to have
who,
special licensing and things like that.
for sure. A lot of training to do
certification.
this. Yeah.
Yeah.
So I have patients who don't like to get their teeth cleaned, so they come in every 6 months and we sedate them to clean their teeth.
That's nice.
It's what we don't judge anybody. If someone comes to see me, and I sense that they're nervous at all, or any type of anxiety about a bad dental experience, sedation's the only way to go.
You also offer that nitrous gas?
We do. Yep.
I love that stuff.
Yep.
For cleaning, it's fantastic.
For sure.
You come up with all these great ideas, and then you realize they're not so good when you're okay again.
You got your notepad ready, huh?
Yeah, exactly.
But the idea is to make this process very easy for people. So people ask me, you know, I can't believe how easy this process was. They also ask me why didn't I do this 15 years ago? Those are the questions I get.
Let's take a look at some more. I hate to rush you.
Yeah.
We're short on time.
So here's Pat, just been, you know, a young guy, right? But just had been plagued with tooth decay his whole life. So Pat probably, depending on who he went to, would have probably been recommended a denture. So there just comes a point in the time where you just can't keep the teeth. So can you imagine being in your 20s and you're a denture wearer?
Are they out there?
And that's for sure. For sure.
There's a lot of young denture wearers?
And that's just a horrible thing. So we gave Pat a brand new smile, and you know, he's ready to take on the world.
So on the day of the procedure, I mean, he comes in with those before teeth and walks out with those teeth.
That's what he walks out with. Yeah.
Very nice.
Yeah. Thank you. Here's Darlene, and Darlene was an expert at hiding her smile. You know, her hand came up to hide her smile. She used her lips to hide her smile. And here's somebody who wanted to become really active in her church, joined some committees, but was just too embarrassed about her teeth. So we gave Darlene a brand new smile. Beautiful. She wanted white teeth. That's what we gave her. You know, Julia Roberts would be jealous of that smile. So you can see how that fills in her entire mouth when she smiles. You can see how the edges of the teeth follow the contour of her lower lip. These are all the things that we spend a lot of time.
It's like a whole new look.
For sure. We're designing a new smile. So and look at those two photos. You know, look at the after Darlene. Is that I mean, look at the confidence that she exudes. And you can see she's still kind of holding back her smile just a smidge.
Okay.
But 20 or 30 compliments from now, she's going to be flashing her pearly whites.
Good.
So here's Deb. And
oh my goodness.
Again,
is that unusual to see this, by the way?
You know, people are so good at hiding their smile. So every day I see patients who are missing front teeth, have tooth decay that they just haven't been able to stay ahead of. But they are experts at hiding their smile. So you see people every day that you don't know are in a world of hurt, in a world of trouble with their teeth. So yeah, they're out there. They're just good at concealing it.
They just don't smile. Yeah, really. Okay.
Yeah. So well, take a look at some family photos. You know, you'd line up grandma and grandpa, and there was always the grandpa who'd smile, you know, with his lips together, right? Like, you know, that's the grandpa who didn't have his teeth in.
You spot
for
that
sure.
everywhere.
Yeah.
Okay.
And people are good at it. So here's transformation for Deb.
Again, no more
brand new
dentures
smile.
for her. There's no way she was going to get a denture.
No way.
That's why they go to you.
Yeah, that's right. Yeah. All that's done while they're sedated, and
that's very nice.
Yeah. Thank you. Randy, I think I showed you Randy last time. So he was wearing a horrible upper denture, didn't show any teeth when he'd smile. And you can just see he's a jovial guy. So within 3 weeks, went from wearing a ill-fitting, ugly denture to getting a brand new set of permanent teeth.
It's nice. And they just maintain them like regular teeth. They see you, get them clean.
We see him for regular checkups.
Okay.
Yeah. So here's Wes. I was telling you a little bit about Wes earlier, Randy, who told me he wore a beard for 20 years and was just, it's transformation for him. So this is the gentleman who didn't know, you know, he just wanted to be able to enjoy a meal, but he didn't know how good he was going to look when we were done. So
you know what, look, when I look at that after photo, those teeth, and I think I've told you this, I feel like I could spot fake teeth walking down the street.
Yeah.
I mean, these really,
they look like just,
I mean, to other dentists, like if I was a dentist, would I say, oh, those aren't real? Because they look as real as you can get.
I'd challenge anybody to try and figure out that those aren't a real set of teeth. Yeah.
Very nice.
Yeah. Thanks. And here's Ed. Ed just had a set of worn teeth. Again, I was telling you, if you live long enough, your knees are going to need replacement, your hips are going to need replacement, and your teeth are going to need replacement. And his were just kind of at the end of the game, so we gave Ed a brand new smile. And
this is another guy that would have ended up wearing dentures.
For sure.
So no dentures.
Yeah, he looks 10 years younger.
He does look better. In fact, in the before, it almost looks like you're forcing him to smile.
Yeah.
Like he probably never
he didn't
really
show
smiled
any teeth
before.
Yeah. You when he would smile, you'd think he didn't have his denture in. So, and look how relaxed his lip muscles and his cheek muscles look. I mean, he's not forcing that smile. Whereas in the before shot, I think he's forcing to show some teeth.
Do you ever run into people like at the grocery store or like around town when they go, "Hey doc, you really help me out"?
For sure. I love a big hug. This is a great joy that
even
I
in
have.
COVID, they want to hug you, but they can't. Right?
Yeah. So when I've got a guy like Ed who gives me a big bear hug when we're all done, when I show him the mirror, and the word I'm looking for is wow. That's when I hear wow, I know we hit it out of the park, and that's usually the first word I hear when I hand somebody the mirror, and. I'm just so privileged to be able to offer this kind of care to people. It just gives me great joy. So, I think what you can see from some of these photos, Randy, is that dental disease, dental cavities, gum disease affects whether you're 20 years old or 90 years old. You can be affected by it. And so I'm hoping what you're seeing from this collage of photos is the variety of people who need this kind of care. Because they're out there. I think I told you could fill the Notre Dame Stadium with people who have trouble with their teeth.
So somebody watching this right now, they are really bad teeth, or maybe they're wearing a denture.
Yeah.
2-3 weeks from now, they got
a brand new set of teeth.
Brand new set of teeth.
Yeah. So we invite them in. We do a complimentary CT scan to show us the amount of bone. And again, 99 out of 100 people have enough. And this process has just been condensed into such a short amount of time.
Do they still see you always on the console?
Always me. Yep.
You're not too much of a big shot now that you're on TV all over the place?
I'm the guy who does this, Randy. So you'll see me start to finish. Yeah.
All right, good. We're out of time. Good stuff. So somebody watching this, they're the two main categories. They're currently wearing a denture, or they have really bad teeth. They don't even, and they've heard what you had to say, and they're still a little afraid, right? Or maybe skeptical. What do you say to them?
I say, come in. Let's have a discussion. We'll meet face to face. I want to hear your story, and I want to tell you what I can do for you. We'll even talk finances if that's a concern.
Good. Yeah. Well, I want to thank you for coming on the show. Always a pleasure.
Thanks,
and all
Randy.
these photos are on your website?
They are.
They can take a look at them?
Just go to the gallery on our website.
All right, thanks again.
Yeah.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.